Good morning. Happy Friday. Long week, busy week, good week. From my far right, Gareth Rhodes, Chancellor James Malatras, Director of State Operations Kelly Cummings, Commissioner Dr. Howard Zucker. To my left, Secretary Melissa DeRosa. To her left, Robert Mujica, Budget Director. Today is day 321. We did the State of the State this week, 4 presentations, which was unusual, but this is an unusual year. And you look at the plans that we've laid out, it was twofold. Number one, New York is going to win this war against COVID. The vaccine is the weapon that will win the war, and we feel good about that. The question is when, how much longer does it go on? And then let's look ahead and let's be ready for the post-war reconstruction. War in and of itself doesn't make progress. You can stop evil. You can stop bad things from happening. But the progress comes in the reconstruction, in the post-war period. That's true throughout history. It's going to be true here again. All governments, all regions are going to look to be competitive in the new economy, the new Zoom economy, the new work-from-home economy. And the question is, what region adapts best? And we want to be in the best position to do that. We have to get from here to there. We have to get through the vaccination period to critical mass of the vaccine. That's 6 months, 9 months, 12 months, depending on who you talk to, and basically it depends on the federal supply, because that's what's driving the timeline right now. Also, we want to start to reopen prior to hitting critical mass in the vaccination process. And that's what we're going to do using testing. Do it smartly, do it safely. The sine qua non for New York's bright future and for New York's relaunch is Washington has to finally be fair to New York State. We've been abused by Washington for 4 years. We've been abused by Washington for decades. Great late Senator Daniel Patrick Moynihan always complained that New York gave more money to the federal government than any other state compared to what it got back. There's always been a mismatch. New York was always what they called the #1 donor state. We gave $1, we got less back on the dollar than any other state. They just actually exploded that when they passed the SALT tax increase to New York. That was 3 years ago. It added $30 billion to the inequity, $2,600 for the average New York taxpayer. And then, on top of that, the federal government just hurt us every way they could. We were a political target for Washington. We couldn't get any federal infrastructure projects approved. We have the lowest Medicaid reimbursement rate in the United States of America. They illegally interfered with our global travel. We were a political target. We were politically extorted by Washington. And now you have new leadership. And we expect the new leadership to right the wrongs. There's a reason why people seek to be in control of government. And once you're in control of government, you are responsible for the actions and the consequences. And the new majority in the House and the new president, we expect them to right the wrongs that were done to the state of New York. And where we want fairness, but we also demand fairness. We need $15 billion from the rescue plan, as outlined by President-elect Joe Biden. And we're going to look for the Senate and the House members to actually deliver that. The $15 billion in the scope of things is a modest amount. New York paid a higher price for COVID than any other state. We paid a price because of the federal incompetence. Federal government never told us COVID was coming here from Europe. It came from months. Federal government told us it was still in China. Either they lied to us or they were incompetent. $15 billion, that's half of the money they took over the past 3 years from SALT. I consider it theft of SALT money, and I consider this theft recovery from Washington. The numbers today, 6% statewide infection rate. We did 300,000 tests, 183 New Yorkers passed away. They're in our thoughts and prayers. Hospitalizations are net down 15, ICU is up 34, and intubations are up 6. When you look across the state, percent hospitalized, Finger Lakes is still #1, down from where they were, but they are still #1 in the state. It will change when that community decides it will change. That's when it will change. There's still personal responsibility, and it's still purely a function of how a community acts. Positivity, Mohawk Valley is the highest at 8.66. New York City, the Bronx is the highest positivity now. Staten Island is relatively down, and that's good news. Staten Island was very high for a long time, and I think that's good news, and I think the community is understanding that their actions have consequences, and it's good to see that reduction. The post-holiday effect. We talked about what was going to happen and when it was going to happen through the holiday season. And much of the diagnosis came true. We said we were going to go into the holiday season, starting with Thanksgiving, and you were going to see the holiday season increase social activity. Activity increases, hospitalizations increase, infection rate increases. Celebrate smart, celebrate smart, celebrate smart. And I reminded New Yorkers every day, people let me know that it was a holiday season and they wanted to celebrate, but I kept saying anyway, I know, but celebrate smart, because we'll see an increase in the COVID transmission rate. And we saw an increase in the COVID transmission rate. This is the positivity. December 25th is Christmas. So Hanukkah, Christmas, Kwanzaa, we shot up like a rocket. Up until New Year's Eve, New Year's Day, and then it started to flatten. Why? Because the increase in the social activity started to flatten. And now we're starting to see a drop post New Year's Eve, New Year's Day. And that is good news. We'd rather not have seen the increase, but I believe the increase would have been worse if we weren't smart and disciplined during the holidays. But now we're starting to see a decrease, and that's good news. But that's also what we talked about. We talked about the actual transmission of the virus increasing through the period of social activity, which was really through New Year's Day, right? After New Year's Day, people start to go back to work or whatever is in the new normal. And you then start to see the positivity, the transference rate decreasing, and that's what we're seeing. What would have happened if we were more reckless during the holiday season? That number would have gone up even more. What would have happened if we were more careful, more cautious, more conservative during the holiday season? The spread would have been less. But we are where we are, and we deal with it. Vaccinations. The federal government started with priorities for vaccinations, and we adopted those priorities, as did most states. First priority was what they call 1A. 1A was basically healthcare workers. 1B was essential workers and 75 old plus. That was the original federal guidance. We accepted it, other states accepted it, and it was almost universally accepted to make sense. You do the hospital workers first, then the essential workers, and then 75 plus. 75 plus, obviously, the older you are, the more you're at risk. Federal government then went from 75 down to 65. We followed that guidance. That added an additional 1.8 million people. So you're at a point now where we have a total population of 7 million New Yorkers who are eligible. There are only 15 million New Yorkers eligible to begin with, because the vaccine is 16 plus, right? So we're roughly half the population is now eligible. When you went from 1A to 1B to 65 plus to 75 plus, you opened it up to 7 million people. 7 million people we're receiving 300,000 vaccinations per week. It takes you about 6 months to do 7 million people at 300,000 per week. Our constraint is the federal supply, and that is creating a scheduling backlog, and it's creating pressure on what was supposed to be the prioritization process. We are now scheduling appointments through the distribution mechanism, which you'll see in a moment, 14 weeks in advance, and most of the distributors are already fully booked because people want the vaccine, which is a good thing. The premise was, by the federal government, when they opened it up to 75 plus and 65 plus, that they would increase the allocation. And the theory was, we'll increase the eligibility, but we'll increase the allocation. That hasn't happened. They increased the eligibility. They did not increase the supply. The Trump administration said they were going to expedite the second dosage, if you remember. And rather than holding back the second dose supply, they would send the second dose, and that would increase a state's supply. It turns out that that was not true. They had already sent out everything they had. So there was no increase in supply. And in the meantime, there was a dramatic increase in the eligibility. So now you increase the eligibility, you don't increase the supply, and now you have a very complicated situation. Not only did we not get more supply, we actually got less this week. We went from 300,000 dosages down to 250,000 dosages. So the eligibility opens up, the supply actually comes down. What they did was like opening the floodgates of eligibility, and you have a rush of 7 million people. I want the vaccine, I want it now, I was told I'm eligible, and that entire flood has to go through a syringe. All this volume, and it has to go through the point of a needle, literally and figuratively. That's the situation that the federal government created. Now, we have our distribution network up and expanding rapidly. We have about 5,000 pharmacies, about 194 hospitals. You have about 2,500 private doctor networks, city departments of health, county departments of health, 58, and then we have state mass vaccination sites, which are just very high volume vaccination sites. To give you an idea, again, 1A, 1B, 75 plus, 65 plus, that's 7.1 million. We have established prioritizations by those distribution networks to make sure everyone gets covered. Hospitals have to prioritize doctors and nurses. City, county health departments, they're in charge of 1B essential workers. They're supposed to be doing the police, the fire, public safety, teachers, et cetera. Pharmacies, doctors' networks, they're prioritizing 65 plus. It is very important that these prioritizations are met. We also are asking the public employees or private employees who are police, fire, teachers, public safety workers, transit workers, if you can self-administer, or if you can just take an allocation and bring it to your provider, or if your EMS workers can do your fire department, your EMS workers can do your police department, please do that, because that relieves stress on the distribution system. And many unions have been very helpful with this. Many police departments have medics, medical professionals, and they are administering to their police. Fire departments, the same thing. Teachers' unions in some places have done the same thing, where the teachers' union will take the allocation, go to a select provider, and that's a big benefit to all of us because it removes pressure on the distribution network. Overall, 74% of vaccine first doses are in arms. That's over the first 4 weeks of delivery, 74%, which, when you look at comparable states, that's a very good number. Obviously, our way in New York is we always want to do better. 827,000 total doses, 731 first doses, 96,000 second doses, because this is 2 dosages. You get the first dose, about 3 weeks later you get the second dose. Vaccination performance is uneven by region, and we study these numbers to see what we can learn. But you see quite a variance. Some of it is explainable, some of it isn't. North Country, all-time high, 90%. Capital Region, 87%. North Country, where you have a smaller population and more of a distribution network, obviously you can get more done quickly. But it doesn't explain in and of itself the variance. You look at Capital Region is 87, Finger Lakes is only 73. Finger Lakes has the highest positivity rate in the state. You would think the people in the Finger Lakes would be the population that most wants the vaccination, knowing that they have such a high rate of infection. You then go down to 76 Mid-Hudson, 78 Long Island, 60% in New York City. Not only is it uneven by region, it's uneven by provider. So Capital Region, week 1 to 3, you have some facilities that are 100%. In the Capital Region, 86% is considered a lower performing facility. Now, 86% is a lot higher than many facilities, but in the Capital Region, that's one of the lower percentages. Central New York, you have some at 100%, and then you have some at 23%, right? So how do you explain that? It's the same period of time. It is the degree of performance of the individual facilities. And that's what we want to point out. Finger Lakes, you have some at 100%. Rochester General, 85%. Strong is 100%. That's why they call it Strong. And then you have, on the lower performing, again, 62%. But that's the range in that region. And you see the differential among facilities in the region. Long Island, many are at 100%. Charles Evans Center, Bethpage, Marcy Medical Center, St. Catherine's, they're at the lower end within that area. Mid-Hudson, many at 100%. Kingston Family Health Center. And this is all going to be on the web afterwards. New York City, you go from 100% to 44%, 42%, 35, 33, 32, 29, 25, 19, 19, 18. That's obviously a major variance. North Country, which is so high, 100%, 96%, is a low performer in the North Country. Southern Tier, also you see a variation. But this is important to understand for all the individual facilities so they can do better. There are no, well, these are state numbers. There are no such thing as state numbers in this regard. These numbers come to us from the facilities themselves, and these are numbers that are submitted under penalty of perjury. So there's no discrepancy about the numbers. You know, if I were to say you reported your gross income to the tax department at $70,000, and I said, you said your gross income was $70,000 under penalty of perjury, also on a tax form. And you said, well, I don't make $70,000. I told people I made $100,000. Yeah, but under penalty of perjury, you said $70,000. And that's all I'm saying. These numbers were submitted by those facilities. And the point is, we have a lot of facilities, a lot of distributors. We want to get needles into the arm. And those were for weeks 1 to 3. But get needles in the arms. That's what we want people to understand. 74%, we have a good percentage. We want to do better. We want to do better. The faster you get people the vaccine, the faster, the better for them and the better for the entire state. And our motto here in New York is life is in the doing. And we understand the concept. Now we have to get the needle in the arm. We also need the prioritization followed. Otherwise, you won't have fairness among the groups. And this has to be fair. It has to be fair by design and by effect. City, county health departments, you are supposed to be prioritizing by law police, firefighters, public safety. Hospitals, you're supposed to be prioritizing nurses and doctors. Pharmacies, you're supposed to be prioritizing 65 plus in the private doctor networks. If you don't follow the priorities, eligible groups will be disadvantaged because the allocation is based on those groups. So for example, if a city or a county health department is vaccinating people 65 plus, then the police, the fire, the teachers wind up shortchanged. Likewise, if a hospital is vaccinating police, public employees, then the doctors and nurses are shortchanged. Likewise, if the pharmacies and the doctor's offices are doing police and fire, then the 65-year-old is shortchanged. That's the point of the prioritization and the law. Focus on your group, and if everybody focuses on their group, there'll be fairness. If everyone tries to do everybody, somebody will be left out. A.J. Parkinson, truer words were never spoken. Facilities doing the first dose must record and schedule the second dose. If John Smith goes to your facility for the first dose, you are responsible for calling John Smith 3 weeks from now and giving John the second dose. That's very important. And that is an administrative procedure, which is tedious, but which is also a priority. This is great news. 96% of nursing home residents have gotten the vaccine, and it's going to be complete by Sunday. This is not great news. We have fewer dosages going from 300,000 to 250,000 as an allocation by the federal government. When we do our distribution is always proportionate regionally to the share of the population. So if Western New York is X percent of the population, Western New York region gets X percent of the dosages. We now have 1,200 sites who are getting allocations. Of the new allocation, the faster sites will get more of the new allocation. Why? Because they get it out the door faster, and this is about getting needles in arms. No one gets all they need. when the federal government creates this situation where you have the floodgates opened and a syringe at the bottom, 7 million people for 250,000 doses per week, every distributor, everyone is going to say, I need more. New York State doesn't get what it needs. You know who says, I need more? I say, I need more. I say to the federal government every day. I must have said it 17 times yesterday to federal officials I was talking to. I need more. You know what every distributor is going to say after they get their allocation this week, which, by the way, is going to be less than their allocation last week because we're going from 300 to 250,000? I need more. You know what every citizen says? I want it faster. Every person I speak to, every family member I speak to, I want it faster. Good, I get it, but we have to understand the situation we're dealing with the supply versus the need, right? The math just doesn't work, and the physics don't work. People with pre-existing conditions, the current CDC and the current federal government, which is going to be current for a number of days, right? They recommend adding now people with pre-existing conditions. We have 7 million currently eligible. That would add about 5 million people. You would then be at 12 million people. We only have 15 million people statewide. It would be easier to do the list of who's not eligible than who is eligible, because it would only be about 3 million people who were not eligible. You would then go from 7 to 12 and still only be receiving 250,000 allocation per week. It would take this confusion and compound it. I'm also very sympathetic and understanding of people who have the pre-existing conditions. There's then a discussion of how you define pre-existing conditions. Pre-existing conditions can go from heart disease to diabetes, to obesity, to smoking, to COPD. So we're talking to the federal officials, we're talking to the incoming federal administration, and we want to get more guidance, and we're looking at numbers on how we could define that category. And we're hoping that we get more federal allocation so we make any of this possible. One major point. Hospital capacity is still the red line, danger zone, shutdown mechanism in this entire situation. California is what we're afraid of. Italy is what we're afraid of. UK is what we're afraid of. You overwhelm the hospital system and you have to close down. That's the ultimate success or failure of the entire effort. It's binary. If the hospitals are overwhelmed, you close down, period, end of story. You close down, everyone closes down. Every restaurant, every office, we go right back to full shutdown. That is the worst case scenario. What is hospital capacity? Hospital capacity is two factors: number of beds and number of staff. We increased the number of beds by 50% in this state. We're the only state to have done it. That's why we're still operating and we're not over capacity. The second component is staff. When you increase the beds in a hospital by 50%, you stretch the staffing ratio by necessity. You had a hospital that had 100 beds, and they were staffed for 100 beds. You then go to 150 beds, and you stretch the staffing capacity. The staff shortage is the issue that is going to overwhelm the hospitals. The hospitals are not saying we're running out of beds. The hospitals are saying we're running out of staff because the staff is getting sick. That's why healthcare workers were the priority. Because if you vaccinate the healthcare workers don't get sick, the hospitals stay open. If the hospitals stay open, it helps everyone. If the hospitals close, it hurts everyone. So it's not just help the healthcare workers for the sake of the healthcare workers, which I believe in, by the way. We celebrate our nurses and doctors. They're on the front line. They're in an emergency room today taking care of COVID people. I'm not. Even a 65-year-old is not. They're in the emergency room. Plus, selfishly, if they get sick and the hospital closes, then no one has a hospital to go to, which hurts everyone. Put on top of that this UK variant, which is frightening. One of the things that keeps me up at night. The other thing is a possible new mutation that is immune from the vaccine. One of the, something else that keeps me up, some issues with some of my children, but that's different. We also have a new UK case in Nassau today, so we're up to 16 cases statewide. And this is all over the country. It just hasn't been diagnosed yet. A higher infection rate with that UK variant puts more people in the hospital, stresses staff more. UK variant can make more nurses and doctors sick, reducing the staffing. It's a dangerous situation that we're in. Long and the short of it is, we need to complete the healthcare workers who were 1A in the first place. We've only done 60% of the healthcare workers statewide. That is not good enough. Remember that the basic benchmark for herd immunity was 70 to 90%. That was herd immunity. We're at 60% with healthcare workers. That is not good. This varies across the state. You have some parts of the state, high, Finger Lakes, 70%, Western New York, 63, Southern Tier, 66, Capital Region, 65, North Country, 70, Long Island, 60, New York City, 59, Mid-Hudson, 57. You go from 57 to 70. You know, this is troubling, to say the least. We ask hospitals, and again, they submit this themselves, the percent of your hospital workers who have declined the vaccine. A very smart person at the Daily News suggested this question. He was right. And this is the variance of people who decline a vaccine. Mid-Hudson, 28% of the people say, I decline. New York City, 13% say I decline. Capital Region, 11% say I decline. Look at that variance in staff that says they decline. This is the variance by region of healthcare staff that has been vaccinated. The highest in the state, so this is statewide, NYU Langone, 99% of the hospital staff is vaccinated. You go to Harlem Hospital, 36%. This is high and low in the state. New York Presbyterian, Columbia, 88%. Good Samaritan of Suffern, 87%. The other end, Brooklyn Hospital, 36, St. Catherine of Siena, 34, Brookdale, 33, Bellevue, 29, St. Joseph's, 23, King's, 27. You go from 23 to 99. That is not, there is no explanation that we can find in these numbers besides the individual facilities' attention to this situation. Capital Region, you go from 85 to 41. Central New York, 76 to 54. Finger Lakes, 80 to 50. Long Island, 81 to 34. Mid-Hudson, 87 to 42. Mohawk Valley, 67 to 37. New York City, 99 to 27. If you're not vaccinating the nurses and the doctors, then they will get sick. If they have the infection, they will be a super spreader. No one wants to go into a hospital and be vaccinated by a nurse who has COVID. You don't help people that way. So we have to do a better job when it comes to this. North Country, 78 to 50. Southern Tier, 86 to 23. Western New York, 83 to 40. The state is making special efforts on top of it, social equity in vaccination, and building trust in the vaccine for all racial, ethnic groups. We do hear anecdotally that some members of the black community are less accepting of the vaccine, and there's a lower acceptance rate. We anticipated that. We talked about it. I think it's two things. I think it's less access, and I also do believe there's more skepticism, lack of trust in the vaccine. I've had numerous conversations. We've been talking about this for weeks, and people say, you know, we're concerned. It was done by the federal administration. We don't have a lot of faith in the federal administration. There are historic reasons for lack of trust. If you went through the Tuskegee experiment, so to speak, from this federal government, you'd have lack of trust. I don't trust a lot of things that the previous administration did. That's the truth, and I'm not going to say otherwise. But this vaccine is different, and that's why we had the New York group then affirm what the federal government did. But there's no doubt that anecdotally we see a difference. If you look at some of those facility differences, why are some facilities 13 while other facilities are 90? I think, query, hypothesis, if you look at the makeup of the staff, you may be seeing variances. It doesn't explain the gross deviations, but it's a factor to consider. But in terms of social equity, the traditional distribution network doesn't reach healthcare deserts. That's why they're deserts. They're deserts because there is no rain. That's why a desert is a desert. A healthcare desert is a healthcare desert because it doesn't have traditional distribution. So we're supplementing that. We said from day one we would supplement that. That's public housing, churches, and community centers. We're setting up mass vaccination sites. We have Javits up and running. These are probably the most effective sites at getting out a large number of vaccines quickly and effectively. They don't prioritize the way the county health departments have to, the city health department has to, the hospital has to, et cetera. But they are the most effective vehicle for mass vaccination, and we're setting up 8 more. Rapid testing is going to be a key to reopening the economy. That's how you can measure. That's how you can use science. We're developing pop-up testing. We're talking to a number of groups, but we're looking for partners, commercial buildings that want to open up their building with a safe building protocol established by the Department of Health. Testing companies to open up pop-up testing all around the state. The more the better, and we'll work with you in contracting, arts, theaters, et cetera. And again, the playoff demonstration project with the Buffalo Bills has worked very well. First of all, they won the game. I don't know that there's a correlation between the COVID testing and winning a game, but I'm going to say there was. But all the evidence so far says that that demonstration worked. So stay tuned, because we are New York tough and loving. Questions?
Thank you, Governor. If you'd like to ask a question, please use the raise hand function at the bottom of your window. We'll take a brief moment to compile the Q&A roster. Governor, your first question comes from Andrew Siff at WNBC. Andrew, your line is now open. Please unmute your microphone.
Governor, how are you? Good afternoon to everyone on the call. Today, Mayor de Blasio said that the city is going to run out of vaccine next week. And he implied that that would be at all the vaccine distribution sites in the city. What can be done between now and next week to prevent that from happening? And as a secondary concern, how worried should people be that they're going to get their first shot but won't be able to get their second shot because the vaccine won't be there?
Okay, let me reverse the order, Andrew. One, you should not be worried about getting the first dosage and then you won't get the second dosage. As I just mentioned, and as we have told the distributors 986 times, as I told them myself on the webinar, as the law says, as the policy says, if the facility gives you the first vaccine, wherever you go for the first vaccine, they have to schedule you for your second dosage, and you go back to that same place for that second dosage. We will make sure, when we do a distribution, we make sure we have the second dose for whoever got the first dose. So Andrew Siff goes to Javits Center to get the first dose. 3 weeks later, you go back to Javits Center. They will have a second dose for you. Don't worry about that. On the second issue, the city running out of supply, they may be some places, I don't know exactly what the mayor was talking about, but some places are working through past supply. So if you look at, let's go to the, do me a favor, pull up the slide for New York City allocations. Many New York City facilities have allocation unused. When we talk about New York City, Andrew, the mayor runs the H&H hospitals and the Department of Health. I think there are 11 H&H hospitals and the Department of Health. You then have about 90 private hospitals. And then you have pharmacies, and then you have ambulatory centers, right? The mayor runs the Health and Hospitals Corporation, H&H, and the City Department of Health. So I think he's talking about that. The private hospitals run privately, and the pharmacies run privately. The New York City, those are the hospitals that by definition are going to have a backlog of unused inventory. And so New York City Department of Health distributed 33% of their allocation. That means they have 70%. So I'm assuming they're talking about working through the backlog. Next week, there will be additional allocations, but less, because the state gets less. New York City, as a region, gets a proportionate share every week. But their proportionate share goes down if the overall state allocation goes down. And we then allocate it among distribution mechanisms in New York City. Private hospitals, you see the hospitals who get it, right? So private hospitals get it, some pharmacies get it, some ambulatory centers get it, New York City Department of Health gets some, and then the H&H hospitals, among other hospitals. So New York City will get more. New York City as a region will get more next week. It will be less because the overall allocation is less. But many of the places in New York City are working through past allocations. That's the only way I can explain it. And that's true in many places across the state. They've been getting for about 4 or 5 weeks, right? Many of them are still working through past allocations. What's going to happen very quickly is they're going to work through the past allocation, and then they're going to be getting very little going forward compared to the need. That's the floodgate in the need. What you can't get past mathematically is 7 million people chasing 250,000 doses. That is the mathematical problem that you can't solve. That's the mathematical problem that the federal government created. We're going to make it open to 75 plus. We're going to make it open to 65 plus. And don't worry, we'll increase the supply because we're going to send you the second dose. Not true. They had already sent the second dosages. We had been receiving second dosages all along. That's how we're doing second dosages. And for some inexplicable reason, not only did the 300 not go up, it went down to 250. Next question, operator. Do you want to add something, Melissa?
Yeah, and just for clarity's sake, so when the governor says we're getting 250,000 for next week, that's 250,000 first dosages. So when you see the fluctuation of the incoming from the federal government, people who have already received their first shot should not be concerned that that impacts their second shot, because the second shot is in a separate allocation that isn't counted in the weekly incoming allocation that's set aside for that person.
Your next question comes from Stacy Sager at WABC. Stacy, your line is open. Please unmute your microphone.
Hi, Governor. Stacey Sager. We're looking into how this unpublished scheduling link was shared without authorization. We've been hearing from so many people at Stony Brook that thought they had appointments, people with pre-existing conditions who are elderly. They're very worried, and they want to hear from you on how this could happen.
Yeah, well, first, Stacy, it's not the first time it happened, right? There's been similar cases. I was reading about a case in New York City today where somehow they put out a link or notification that there was going to be a vaccination site, and people swarmed to the site. But let me ask Melissa, who has more information than I do.
Sure. So yesterday, late in the day, we became aware of the fact that there were unpublished links that were set to go live this morning for certain sites that had not been brought online yet, that and I don't want to speculate on what it is because it's since been referred to the Inspector General's office, so they'll do their review, but the hypothesis is either it was hacked or there was someone who leaked the link. And we understand the frustration if somebody got the link not knowing that there was devious intent behind how it got out. However, as the governor said, there's 7 million people vying for 250,000 shots, and the system to sign up has to be fair. And so we felt that it was important that we reset those appointments, and when they went online this morning to the public, everyone had the same fair shot at getting those appointments because, as we know, they're so incredibly limited. So there is an investigation ongoing. When the results of that investigation are complete, we will tell the public exactly what we know, but that's how we got here.
And you know, Stacy, it's going to be a bigger problem than that, unfortunately. When you have 7 million people and you have this kind of demand, and when you say it's a limited supply, you create a tension and an anxiety in and of itself. You're going to have fraud. You're going to have a black market. I've contacted the Attorney General's office and asked her, Attorney General Tish James, please watch out for possible fraud. You'll see people on the internet saying, I'll sell you the vaccine. Some of it will be fraudulent, but some vaccine along the way, some vials. These are tiny vials, right? A vial has 10, 11 doses in it. You'll see some vials stolen. I would wager it because they are valuable. So you're going to see hacking, fraud, theft. It's almost predictable, as ugly and as unfortunate as it is. Next question. Operator.
Governor, you now have Zach Fink from New York One. Zach, your line is open. Please unmute your microphone.
Mr. Fink, unmute. First time I ever had to tell you that.
Stand by. We are having technical difficulties.
Oh. Figured it was our side as opposed to Mr. Fink's side.
Governor, your next question comes from Juliet Papa. Juliet, your line is now open. Please unmute your microphone.
Hey, good afternoon, Governor. How are you?
How are you, Juliet? Good to hear your voice.
I'm good, thank you. So I was wondering, given that you have limited access to supply, is there any way you can, negotiate your own supply from the pharmaceutical companies? Is that feasible, doable, legal?
See, Juliet, New Yorkers think the same. I have queried the same. Pfizer is a New York company, but the answer is no. The federal government controls all the purchasing, all the production, and all the allocation. And the federal government's allocation is proportionate to population. But we tried that. You know me, Juliet, I've tried everything. But it's a good idea, but it didn't work. Next question, operator.
Governor, your next question comes from Bart Jones at Newsday. Bart, your line is now open. Please unmute your microphone.
Hi, Governor. Could you just respond a little bit? There are a lot of complaints out there about the state website for signing up for the vaccinations. It seems to be quite a bit of turmoil. A lot of people are saying it's not really working very well. Can you respond to that? And also, the CDC numbers are saying that you guys have more than 1 million unused vaccines. If you go on their website this morning, they're talking about 1.9 million delivered to New York or sent to New York, and only about 700,000 used. So that leaves about 1.2 million unused. I know you just said this morning you've had 74%, put in arms. Can you folks explain or clarify that? And finally, on the Stony Brook situation, do we know how many people had their appointments canceled from that Stony Brook situation?
Okay. I'll ask Melissa to talk about Stony Brook, Gareth to talk about the numbers. But remember the Stony Brook situation, Bart, that was a fraud, right? There were people in New York City who showed up because there was some fraud that there was going to be a vaccination site. Consumers have to beware. People will offer to sell you the vaccine. People will say, come to my office, I'll give you the vaccine. People have to beware. That was just a fraud. On the CDC numbers, look, I take everything nowadays the CDC says recently with a grain of salt, but I'll ask Gareth to talk about that. On the state website, let's understand the facts. The state doesn't do distribution. We set up some retail distribution. We're setting up some mass vaccination sites, but they're really to catch overflow more than anything else. The distribution is done, as I just showed you on the screen, the county health department, hospitals, ambulatory centers, pharmacies. The state website connected people with pharmacies, county health department, et cetera, in their area. What happened is they're fully booked because you have so little supply for so many people. So if you go to the CVS website, punch in your local area, you'll find your local CVS, and chances are they're going to say, we're not taking any more appointments. Same thing for all the other drugstores, and same thing for the other ambulatory centers that are there. So you can go to a website. Our state website was really an assemblage of available websites. But yeah, it said CVS full, Walgreens full, Rite Aid full, Doctors Annex full, because they were full. And the state itself doesn't do retail distributions, right? Nassau, Suffolk, we're going to open up a couple of mass distribution sites now, Jones Beach. But really, it's the pharmacies, the counties, it's the doctor's offices. And our website was just an assemblage of those. It referred you to those websites, and those websites said, we're booked. Melissa?
Yeah, also on the website situation, so when we first launched the website in anticipation of servicing 1A, which quickly became 1B, which quickly became 1B+, the idea had been that it could serve as sort of a one-stop shop into all of these other places that the state was allocating vaccines to: pharmacies, local health departments, hospitals. What ended up happening was all of a sudden we went from a manageable universe to 7.1 million instantly. People that were going onto the site were also then going onto the pharmacy sites, were also going onto local government sites. The crush of all of that pass-through was causing the servers to go down. What we've done since Monday, since Tuesday, was we've made the site a lot more simple and clear. People should call their local pharmacies, people should call their local health departments, people should call their local hospitals and see if they have availability to make an appointment or go on those websites. And it's now removed from the state site. So you remove all of that additional traffic from the state site, which will help the state site function better. The larger issue, as the governor articulated, is that you have 7 million people trying to get 200,000 appointments. And at this point, several of the state locations that are booking as far as 14 weeks out already booked. And the state website is going to be updating every 3 hours to say, SUNY Albany booked for the next 14 weeks. Because I understand part of this is general frustration with people who are trying to get through on the site, who are trying to book appointments for family members, and it feels like you're banging your head against the wall. So we want to make sure that communication is as clear as it possibly can be, while we're also trying to deal with the issues of the general website and the influx of people who are very eager to get the vaccine. On the number of people at Stony Brook, it was approximately 20,000 people that had signed up for appointments through Stony Brook. And just to put that into context, Jones Beach, which is completely sold out, which went up online appropriately, which no one got appointments to early, had 55,200 appointments on the website. And those filled up like that in 2 days. So what happened with Stony Brook is you're basically saying half the capacity of Stony Brook would have been gone before any real member of the public who did not have this fraudulent link was able to sign up to begin with. And that was where the system was really unfair, and we needed to address that issue.
Bart, just to stay with this for 1 second. We have about 1,000, we have over 1,000 distributors statewide. Pharmacies, county health department, hospitals, et cetera. 1,000, over 1,000. The state website is only a collector. Of those 1,000, state doesn't really operate any. We're starting some mass vaccination sites like Jones Beach, but there's only like 10 of them or something. Our website was the collector of the 1,000. So punch in your address and it'll tell you the distributors in your area. But when you then went to the distributors in your area, they were all booked. So it was frustrating. So we got out of the collector business, and we'll tell you who. It's pharmacies, doctors, hospitals, local health department. And then for the sites that we are running ourselves, how many are there now, Kelly?
We have 5 operational right now. We are opening 8 additional statewide starting next week. And a week after that, we will be adding to it. We'll have a total of 20 state sites in every region of the state.
So our 13 state-operated mass sites can be scheduled through the state site. Otherwise, people have to go to the county department, city health department, or the local pharmacies. Gareth, you want to speak about the numbers, CDC?
Sure. There's no discrepancy here. The CDC number on its website is a global allocation number to New York. That is not necessarily what has been delivered to New York so far. It also includes the long-term care facility programs, which are federally run through the pharmacies. And in that is, once New York opts in, over the period of weeks that program runs, the full amount shows up as allocated, even though much of that has not been delivered yet and will only be closer to the date. New York, the numbers that we put up today, we put up every day. We are not putting in there the doses that are continuing to come in through this week. So we've received through week 1 through 4, 1.1 million doses. That's what's being distributed and put in people's arms right now. Of that 1.1, as the numbers were shown on the screen, 730,000 doses have been administered. And of the second doses, we receive exactly the same number of doses 3 weeks later for Pfizer and then 4 weeks later for Moderna. The 170,000 second doses have been delivered. But if you break this out if you take out the long-term care facilities program, which is a federally run program, New York's got about 844,000 doses delivered to date. Of that, 623,000 have been administered. That's 74%. So that was the number you saw on the slide. And you saw the regional breakdown of that as well. For example, closer to 60% in New York City. Outside of New York City, closer to 86%. It varies by region. But the administration numbers show that based on what we have on hand so far, New York is doing very well.
Operator, let's take one more question.
Governor, you now have Zach Fink from New York One. Zach, your line is open. Please unmute your microphone.
Hey, Governor, I think we found a solution here, although I'm not going to be able to hear you. But I did want to ask, number one, we're hearing that the federal government's not being able to come through with this in terms of the supply. Is there a reason? I mean, is it federal incompetence? And I also wanted to get your reaction to the AG's lawsuit against the NYPD. Do you feel a federal monitor should be imposed on the department? Is that where we're at?
Yeah. Let's do both. One, Zach, I think, look, I am not a big fan of the current federal administration. Shocker, as that statement may be. I think what they did was politically motivated. We'll open 1A, we'll open 1B, we'll open 65 plus, we'll open people with comorbidities. Don't worry, we'll address the supply. So on the way out the door, they could say, we made it eligible to everyone, and we increased supply. Except they didn't. And even what they said they would do was implausible. We'll accelerate the second dosages. They already were accelerating the second dosages. They gave us the second dosages as soon as our people were eligible for second dosages. They did not secure any additional supply. They didn't buy more Pfizer or buy more Moderna or approve Johnson & Johnson or approve Oxford AstraZeneca. They didn't do anything to increase the supply. They had the supply they had, and that was it. So I think it was all politics. We're going to open it up to everyone. Nobody should be treated differently. Forget the prioritization. We open it up to everyone. Pat me on the back. But there's no supply. And by the way, I leave next week. So that's where we are. On the Attorney General's investigation, the findings are very troubling and disturbing. As you know, I'm a former Attorney General. I dealt with many issues with the NYPD. I asked the Attorney General for the investigation after seeing the video of the protests and some of the actions and the uproar from many legal advocates in New York City. I applaud the Attorney General for the thoroughness of her action, and I applaud the Attorney General for her courage. You know, it's hard to speak truth to power. It's hard to speak truth to the NYPD. It's hard to speak truth to the mayor of the city of New York. But she did, and that's what doing justice is all about, and that's what leadership is all about. So I applaud her personally. But it is troubling on a fundamental level. And what's most troubling about it is it's nothing new. People have been complaining about this for years. The kettling policy had been discussed for years. The people were told that it was over. And for years, people were saying it wasn't over. And there were lawsuits, and there were videos. So in some ways, what's most disturbing to me is the fact that it only confirmed the worst information that people assumed, that they were being lied to. And I think the people of the city deserve an apology, number one. I think this is a very complicated, tense situation now that exists between the NYPD and the community. I think the tension is destructive on everyone. You have a shooting crisis in New York City. You have a COVID crisis, and you have a crisis in the increase in crime and shootings and the lack of solving these shootings, the tensions between the community and the police, the lack of trust, and the tensions for the police officer. You know, you're a police officer, you're following the policy. You're not a policy maker. City Hall makes policy. The commissioner makes policy. You don't make policy. And to now find out that these policies were coming from the top, and these policies were what was creating the tension, there's a lot of work to do. But I think the people of the city deserve an apology. I think we have to work on now moving forward. The monitor is really the only thing the Attorney General can ask for legally. The Attorney General legally can't say who should be replaced. So the legal option for the Attorney General is a monitor. I think we have a train coming down the track that is going to get there first, actually. By April 1, New York City has to submit a new public safety plan. April 1 is April 1. And Zach, I understand deadlines in New York City. They're supposed to be out of Pier 76 by January 1. They're still not out. April 1 is April 1 because April 1 is the day the budget is signed. And they will not be in the budget if they don't have a passed new police plan. And that is not going to be a deadline that can be blown. Because as you know, when the budget is signed, the budget is signed. And I said months ago to every locality, we have 500 localities with a police department. I said to them months ago, form a collaborative, put everyone around the table, let everyone speak, let everyone vent, discuss the real issues. I went through them in the state of the state. What should the use of force policy be? A lot of important questions. Communities all across the state are doing it. They're doing it. They're making great progress. And by the way, it's a positive exercise. It's not easy because you have tensions, and both sides has to say their piece. Community is going to talk about use of force and brutality and abuse and perception of racism. The police are going to say, how do you expect me to do my job if I can't even touch someone? And how can I do that without touching them above the waist when they're coming at me with a knife or a gun? You have to have that conversation. But they have to have a plan in by April 1. That's like 9 weeks. It has to be passed by the city council. I don't see New York City theoretically has the police department in charge of the reform plan, which, by the way, doesn't make any sense to me. There is no agency that is going to reform itself, right? The agency is doing what it's doing because it believes it's doing the right thing. How should you change your reporting style, Zach Fink, to be a better reporter? I know your answer. I'm the best reporter I can be. Everything I do is right. Zach Fink, reform Zach Fink's reporting style. You can't. You can't ask an agency to reform itself. Well, there's an advisory board. But there's 9 weeks. You have mayoral candidates who are now talking about wanting to run New York City. How would you reform the police department? You have all sorts of criminal justice reform groups. How would you reform the police department? You have people within the police department who have ideas on reform. And the city council has to pass this. And it's 9 weeks. And that deadline is not going to be waived. That is not going to happen. Government has to perform. And this is critical. And it's not just critical because of April 1. It's critical because the increasing crime is compounding the problems in New York City. Yes, you have COVID. Yes, you have increasing homelessness. Yes, you have people who are concerned about the long-term economic viability. And you have increasing crime. If you look at the economic cycles, you are not going to have a strong economy if you don't get the crime issue under control. I'm old enough to remember, and I'm a native New Yorker. Not that we don't love people who move in, but I was born here, I grew up here, I remember what it was like. And the rate of crime, the strength of the economy, there's a parallel. And we have some problems we can't figure out. We can't cure COVID yet because we can't produce the vaccine. Fighting crime, restoring the relationship with the community, that we know how to do. And use this as an opportunity. It was already clear that you had to reform the relationship between the police and the community. It was already clear that this was not working. You're not even using the NYPD, right? Everything is the sheriff's department now. There's only 150 sheriffs. I never heard of the sheriffs being used to do these types of activities before. So clearly there was a problem. You put the lawsuit on top of this, then for sure you have to move forward and get something done. And I think April probably comes before the monitor. I don't think the monitor could be a negative. They've had monitors before, but it doesn't substitute for political accountability. This is a political matter and political accountability. and the council has to pass a plan. And the council has to pass a plan by April 1. And I haven't even heard a discussion about it. And they have to have a conversation with the community, and that's going to be some conversation, and it should be. Thank you, guys.